welcome back to Dr. Noah's YouTube update. And so we'll just review what's just happened over the last couple days in October 2011. The American Academy of Pediatrics has come out and warned us that you should not put children under 2 in front of a TV. We need so-called medical doctors to tell us that little kids shouldn't be in front of a TV under 2. And what was interesting about this is that there's no scientific evidence that these so-called educational programs have any benefit in terms of helping children kind of grow like that. So TV, stay away from that. Try to interact with your child. Try to do the best you can here. As we talked about in other video here, every year the United States healthcare system gets a grade, just like you as a student or your children that go to school get a grade, and they go from 0 to 100. And well, good news is that the United States, actually I'm being facetious here, scored a 64. So I don't know what school you go to, but a 64 is close to an F. And so that's within that in terms of a national type of survey, in terms of what's helping. What was interesting about this study saying is if they were able to go from a D minus to like a B or an A, just in terms of infant deaths, that would save 91,000 lives a year just by having a better type of healthcare system. So even though we spend the most money, over almost $3 trillion a year, we get a 64% return on that great care. One of the things that we've talked about quite a bit is that your teeth have a big impact, just like any other part of your body like that. This study here in Journal of Gerontology Research 2011 showed that tooth decay was tied to bowel cancer, colon cancer. So that's once again showing you that everything is interconnected. What happens to your teeth, and dentists have really jumped on the bandwagon, rightly so, is that keeping a healthy mouth is more than just keeping your teeth intact, but it helps prevent heart attacks and now actually bowel or colon cancer. The next study showed that in terms of basically females are actually that have mammography are actually being exposed to not only radiation but also in terms of unnecessary type of procedures. Now this was only published in the Radiographic Society of North America, showing that that by having women exposed to mammography under 20 increased their chances of breast cancer by 250%. That just came out. So this whole notion about let's walk and let's save money and let's be nice to women is just not factually based. The Journal of National Cancer Institute shows you that this is able to trigger. These are ionizing radiation. So just I've talked a lot about that. There's a classic study that was published in Archives of Internal Medicine where Norway stopped doing mammography and then they introduced it 2 years later, and they show a direct on and off correlation of when there was no mammography done, breast cancer rates went down. They started screening women again and went back up. It was about 3 or 4 years ago they actually in the American Cancer Society report, which is an annual report talking about cancer, they kind of slipped up because they actually confessed that for the first time since the 1930s they've been doing it, breast cancer went down for 2 reasons. Hormone replacement therapy was reduced because of a study that was done in 2002 showing that it did in fact increase breast cancer and other kind of cancers and heart attacks and pulmonary emboli, terrible stuff. They estimate it murdered about 6 million women. Nice. They must really like women a lot. To be able to deal with hot flashes, which are very, very easily cared for natural type of things. And the other one was so hormone replacement therapy and mammography was reduced. So it's well established. You see that from epidemiological type of studies just showing on and off. Studies conclusively showing pros and cons in terms of mammography. There is no pros, it's all con. So that's it for this week. See you next time.